raised in a small town, a really, really small town. We had a population of 300. My high school class was 16. We had one gas station, one bank, 2 churches, and we had the whistle. It sounded like this. The whistle was this loud siren, and it was mounted to the top of the water tower in our city park. That whistle blew every day, 4 times a day, 365 days of the year. It blew at 7 a.m. That was our community's wake-up call. It blew at 12 noon and at 1 p.m. That was our reminder to take a break and then get back to work. And it blew at 6 p.m. And I'm not exactly sure what that meant to the adults in my hometown when I was growing up, but as a kid, that whistle was my mom's voice telling me to get home for supper. I don't really know the reason for the whistle. I don't know the origin. I don't know why it blew. I really don't know who decided that it should. It just did. And it created this reliable rhythm, this trusted pattern for the first 18 years of my life. That whistle, in fact, may be the reason that I became an epidemiologist. After all, epidemiology is the study of patterns. Patterns in groups of people, patterns of health and disease, patterns that are often difficult to see. There's a classic story in epidemiology that happened in London in the mid-19th century. Now, London was a dirty city, it was a polluted city, it was an unsanitary city. It was very crowded, 2.4 million people in an area the size that Lincoln, Nebraska is today, about 90 square miles. To us today, London may have seemed like a disaster waiting to happen, and it really was, because cholera was rampant. It was killing tens of thousands of people in Victorian England. And in 1854, a violent outbreak struck a poor neighborhood in London. Now, cholera was a horrible disease, and it caused a horrible death, but people just accepted it as a product of living in this dirty place and breathing this dirty air. Everyone believed that except for a young anesthesiologist by the name of John Snow. He believed it was the drinking water that was poisoning that neighborhood. So he did something that was very visionary for this time, and that is that he enlisted the help of someone from that neighborhood, someone whom the people trusted, a pastor. And together they walked door to door and spent hours going into the homes of people who were dying of cholera, talking to their family members, asking questions, looking for clues. It was an incredibly brave thing to do. They walked into the eye of a storm, into the face of a disease that had no known origin and no known cure. And keep in mind, Dr. Snow did this for a neighborhood where he didn't even live. This is the actual map that Dr. Snow kept as he walked through the neighborhood. And he marked each cholera death with a hand-drawn rectangle. And when he was done, he looked for patterns, and he looked for clues, and he found them. Because right there in the epicenter of those cholera deaths was a water pump, a drinking water pump. He took this information to the health officials of the day, and even though they were still reluctant, they removed the water handle pump, and the epidemic stopped. This is such a simple map by today's standards, but it's so powerful. And not just because of the data that it shows, but how that data was put into action to save a neighborhood, to change the course of infectious disease management, to change the course of modern medicine. And it has to make us wonder, if a simple map from 1854 can do that, what could maps tell us today about our communities, about this community, about Lincoln, Nebraska, this 90 square miles of earth that I call home? So about 2 years ago, the Community Health Endowment began a mapmaking project. We started thinking about how geography influences us. And to be honest with you, I began this process as a scientist, as an epidemiologist. I wanted to take information, make it visual, draw some conclusions, help make some decisions. It was going to be neat and tidy, easy, right? So we made maps. We made more maps. We made hundreds of maps. And we revealed them to thousands of people in our community. And I will tell you that along the way, something changed for me. And I think what it was is I couldn't help but look at these maps differently, not through the eyes of an epidemiologist or as a scientist, but through the eyes of someone who lives here, as a neighbor, as a friend, as a parent. I think that change began when I saw the map on life expectancy. Now, life expectancy is how long a baby can be expected to live if they are raised in the neighborhood where they live when they're born, given the risk factors that are there during that time. In the United States, the average life expectancy is 78. In Lincoln, it is 80. We live longer here, so we win, right? Well, not exactly, and not for everyone. Because what you'll see on this map is that looking across our community, there's a huge disparity in life expectancy. In fact, if you look in the core of our community and then you look just a few miles away to the edge, there is a nearly 30-year difference. That's an entire generation. And that's when this information stops becoming just data. When this stops becoming science, that's when it becomes hard and humbling, when it strikes deep into the heart of a proud community. This is the kind of information that you just can't unsee, or at least we shouldn't. Let me ask you this question. Where did your eyes go when you first looked at this map? I know where mine went, right to where I live. And you know, that's okay, as long as we simply just don't unsee what's happening elsewhere in our community. What if Jon Snow had done that? Let me talk to you about the big swings that we need to take to change this, because accomplishing longer life expectancies across our community means that we have to do some big work, some really big work, big swings. I believe one of those big swings is addressing childhood obesity. We know that a child who is obese as a child is more likely to be obese as an adult. And an obese adult will live on average about 8 years less than an adult who's not. That's a big swing. Our community knew that, and we went after that. We, in fact, set a goal that no more than 15% of our children from kindergarten through 8th grade would be considered obese by the year 2020. Lots of people did some incredibly amazing things, and you know what? We achieved that goal. And we achieved it 6 years ahead of schedule. We celebrated that. We felt good about that, and we should. But then there's this map. And this map shows you where in this community that goal has not been met, where children still exceed that 15% standard, in some places still twice as high. Again, achieving a goal in only part of our community means that we have work to do, and it's not simple work. Child obesity is a complex public health epidemic. It's interwoven with so many other social factors. And I think perhaps the most significant of them all is poverty. Poverty is our poisoned water. You can look through these maps in every combination, and you can look at them through every lens, and I think you will come to the same conclusion that I have, and that is that poverty makes people sick. And being sick often leads people into poverty. So the confession that I have to make for you today is that this was not easy. This was not simple. It was not tidy. It was not a data exercise after all. Because I think these maps are far more powerful for the stories they tell us than for their data. They are telling us big stories, and they're telling us loud stories, stories that are shouting at us. What are you willing to accept? What will we do now with what we now know? These maps have the potential to polarize us, to create this us versus them mentality, to marginalize people by virtue of where they live. But you know what? They also have the power to bring us together around a common knowledge of the work that we have to do. These maps can be our whistle. They can be our wake-up call. They can be our reminder to get back to work. One last confession. These maps scare me. Because if I learned anything from Jon Snow, I learned that big swings mean big risk. Ice in your veins boldness. The kind of boldness we will need to answer questions like, will we be teachable? Will we be humbled? Will we care? Will we care about neighborhoods where perhaps we don't live? Will we care about generations that we may not live to see? Perhaps the biggest question of all is, will we invest in lives that are not our own? If it is a village of 300, if it is a city of Lincoln, Nebraska, a city on the other side of this continent or on the other side of the globe, there is a common thread that we all share, and that is that these places matter. And these people matter. Because when it is all said and done, we will win or we will lose together in these places that we all call home. Thank you.